If you have a Medicare Advantage plan, I need you to stop what you're doing and watch this. Not tomorrow, right now. Because if you're enrolled in one of these plans, and there's a very good chance you are something changed in 2026 that your insurance company was not going to pick up the phone and explain to you. And what change could cost you hundreds, maybe thousands of dollars this year if you don't know what to look for. We're talking about over 1 million seniors who woke up in January with less coverage than they had in December, and most of them didn't realize it until they showed up to a doctor's office or a pharmacy. And by then, the window to act without penalty had already closed for many of them. So let's walk through this together step by step. What changed, why it changed, who got hit hardest, and what you can actually do about it right now. Think about a woman named Carol, 68 years old, retired teacher from a small town outside Dayton, Ohio. Carol had been on the same Medicare Advantage plan for 4 years. She liked it. Low premium, dental coverage, a vision allowance she used every year for new glasses. She wasn't rich, but she was careful with money the way people are when they've watched a pension and a Social Security check carry them through every single month. In October, Carol got a packet in the mail from her insurance company. It was thick, lots of pages. It had a heading that said annual notice of change. She flipped through it, didn't see anything that jumped out, set it on the counter. She had groceries to unpack. She figured if something big had changed, someone would have called. Nobody called. In February, Carol went to her dentist. The routine cleaning she'd had covered at no cost for 4 years, gone. Her plan had dropped its dental benefit entirely. She owed $180 at the desk. Then 2 weeks later, she went to pick up a prescription she'd been taking for her blood pressure. Her copay had gone from $8 to $47. In 2 months, Carol had lost over $200 she hadn't budgeted for on benefits she thought she still had. And she's not alone, not even close. Here's what's happening at the structural level, and you deserve to understand this clearly. Medicare Advantage plans, the private insurance alternative to original Medicare, are required to send you that annual notice of change every fall. It lands in your mailbox in late September or October. It lists every benefit that's changing for the following year. The problem is that the document is written by insurance companies, not for you. It's designed to be technically accurate and practically unreadable. And the system assumes that if you don't switch plans during the annual enrollment period, which runs from October 15th to December 7th, you're happy with whatever changes are coming. You didn't agree to those changes. You didn't sign a new contract. You just didn't say no in a specific window, and that silence was treated as consent. That's the rule. That's the structure. Not malice, not conspiracy, just a rule that was written decades ago and has never been updated to reflect the reality that millions of seniors have these plans now, and most of them don't have the time, energy, or support to read 50 pages of insurance fine print every October. Now, let me tell you what's actually getting cut in 2026, because this is where it gets specific, and you need to know exactly what to look for on your own plan. The categories taking the heaviest hits this year are dental, vision, hearing, fitness benefits like gym memberships, and over-the-counter allowances. Some plans that offered a quarterly allowance for things like vitamins, bandages, or pain relievers have reduced that allowance significantly or eliminated it. Some plans that cover dental extractions or crowns have pulled back to cleanings only or dropped dental entirely the way Carol's did. The hearing benefit cuts are particularly significant. And I want to sit on this for a second because hearing aids are expensive. We're talking about devices that can run $2,000, $3,000, $4,000 out of pocket at retail. Some plans that were covering one hearing aid per year or contributing a set dollar amount toward the cost have reduced that contribution by half or eliminated the benefit for 2026. Vision cuts follow a similar pattern. The eyeglass allowance that used to cover most of a new pair of frames and lenses has been trimmed at a lot of plans, sometimes from $200 or $300 down to $100, sometimes dropped altogether for contact lenses even when frames are still covered. And then there are the network changes. This is the one that can hit hardest and the one that's hardest to see coming. Some Medicare Advantage plans narrowed their provider networks for 2026. If your doctor or your specialist or your hospital is no longer in network, you're either paying out-of-network costs, which can be dramatically higher, or you're changing providers. And for someone managing a chronic condition with a doctor they've trusted for years, that's not just a financial problem, that's a health problem. I want to be clear about something here, because this channel is always going to be straight with you. Everything I'm walking you through today is general information about how these changes work at a structural level. Your specific plan, your specific situation, your specific doctors, that's something you need to verify directly with your plan. And if needed, with a licensed insurance counselor or benefits advisor who knows your state and your circumstances. I'm here to make sure you know what questions to ask. I'm not here to make decisions for you because that's not my place. And frankly, it shouldn't be. Social Security and Medicare rules shift every single year, and nobody from the government calls you up to explain what those shifts mean for your household. That's exactly what this channel is here for. Subscribe and turn on the bell, and you'll never miss an update that could matter to your money or your health coverage. Now, let's get into what you can actually do, because this is the part that matters. First thing, pull out that annual notice of change if you still have it, or log into your plan's website and find the summary of benefits for 2026. You're looking for the benefits section. Go line by line through dental, vision, hearing, fitness, over-the-counter, and Part D drug coverage. Compare what you have now to what you had last year. If you don't have last year's document, call your plan's member services line and ask them to tell you what changed from 2025 to 2026. They are required to answer that question. Second, check your drug formulary. This is the list of medications your plan covers and at what cost. Formularies change every year. If you're taking a brand name medication or even a generic, look it up on your 2026 formulary and confirm the tier it's in. Tier determines copay. A drug that was tier 2 last year at a $15 copay could be tier 3 this year at $45. That's $360 extra per year for one medication. Multiply that if you're on multiple prescriptions. Third, verify your doctors are still in network. Don't assume. Call the office or log into your plan's online directory and look up each of your regular providers. If your primary care physician or a specialist you see regularly is no longer showing as in-network, call your plan before you schedule that appointment. Out-of-network costs under Medicare Advantage can be significantly higher, and some plans have no out-of-network coverage at all outside of emergency care. Now here's the part that most people don't know, and it's the part I want you to hold on to. Even though the main annual enrollment period ended on December 7th, you are not necessarily locked in with no options. There is a window called the Medicare Advantage Open Enrollment Period that runs every year from January 1st through March 31st. During this window, you can switch from one Medicare Advantage plan to another, or you can drop your Medicare Advantage plan and go back to original Medicare and add a Part D drug plan. Let me be direct about what that means. If you are sitting in a plan right now that cut your dental, dropped your doctor from the network, or doubled your drug copays, you have until March 31st to make a move. Not forever, not all year, until March 31st. After that, you're in the plan through the end of 2026, unless you qualify for a special enrollment period, which is a separate category with its own qualifying conditions. Things like moving to a new service area, losing employer coverage, or your plan being terminated. Here's where I want to do the math live, so this lands for you. Let's say you're on a Medicare Advantage plan, and between the dental cuts, the reduced vision allowance, and one drug moving up a tier, you're going to pay an extra $800 out of pocket in 2026 that you weren't expecting. That's real money. That's $800 that was in your budget last December and isn't there now. If you switch during the Medicare Advantage open enrollment period to a plan that still carries the dental benefit, maintains your network, and covers your drugs at the same tier, and there may well be one available in your area, you could recover most or all of that $800. You'd be doing the legwork now instead of paying the bills later. The tool that makes this comparison possible is the Medicare Plan Finder on Medicare.gov. You can put in your zip code, your medications, and your doctors, and it will filter available plans by what they cover and what they cost. It's not perfect, but it is the closest thing to a side-by-side comparison that's publicly available and free. Another resource worth knowing about is your state health insurance assistance program called SHIP. Every state has one. These are free counseling services for Medicare beneficiaries, not insurance salespeople, not brokers on commission, trained counselors who can sit down with you, look at your actual situation, and help you compare plans or understand your options. You can find the contact information for your state's SHIP program at shiphelp.org, or you can call 1-800-MEDICARE and ask to be referred to your local SHIP. Now let me bring it back to Carol. When Carol finally understood what had happened after she'd already paid those unexpected bills, she called her county's SHIP program. A counselor walked her through the Medicare plan finder, found a plan in her area that still had a dental benefit that covered cleanings and basic procedures, kept her same primary care doctor in network, and had a lower copay tier for her blood pressure medication. Her monthly premium was going to go up by $12. But her estimated out-of-pocket for the year was going to be about $600 less than if she stayed on her current plan. She made the switch before March 31st. It took one phone call and about 40 minutes of her time. Carol's story isn't unusual. It's actually the story of what happens when someone finally gets the information they were owed from the beginning. When someone sits down and explains the system in plain language instead of sending a 50-page document and hoping for the best. You did nothing wrong. The system just doesn't tell you this. What it tells you is that you have coverage. What it doesn't tell you is that coverage can quietly shift under your feet every January, and the only way to catch it is to know what to look for and when you can act. Here's what I want you to do today. Not this week, today. Pull out your 2026 plan documents or log in to your plan's website. Check your dental, your vision, your hearing, and your drug formulary against what you had last year. Call your doctor's office and confirm they're still in your network. And if anything looks off, if benefits are gone, if your drugs cost more, if your doctor is out of network, remember that you have until March 31st to switch. That's not a forever window. Mark the date. If you've already found a change you didn't know about, or if you went through this and everything looked fine, I want to hear about it. Drop your experience in the comments. I read every single one. And if you know someone who's on a Medicare Advantage plan and hasn't checked their 2026 benefits yet, send them this video. That phone call you make today could be the one that saves them a year of overpaying for coverage they thought they had. The people who watch this channel are people who worked hard, played by the rules, and earned every benefit they're collecting. The least they deserve is someone who explains those benefits clearly, in plain language, every time the rules change. That's what we're here for.